The key thing is, again, looking at the root cause of the problem.
The root cause, and I always tell you guys that root cause is very, very important. What is the problem?
And that's what we focus on here to really, and what we call is putting them through a differential diagnosis. You may come in with hip pain, it may not be coming from your hip. Okay, so it's really up to us to go ahead and put you through an extensive evaluation to see what's going on. Evaluate where the dysfunction lies, and then again giving you the education, but we have to, as the clinicians, really do the work to get your mechanical body working like it's designed to work. And that's where I think there's usually a downfall in medicine, because we're looking to just treat the symptoms, which is maybe one thing that's totally in another ballpark when you have to address the root cause. When you address the root cause, it may be a little bit of a longer road, but you're down the right path and you're going to get the patient better. And the key thing is just making sure, again, you do constant checkups and to see, is this the right path? There may not be the right path, but again, it's you have to do and put the patient through a constant reevaluation to see, is this holding? Is this the pathway? But the key thing is just not going ahead and giving them a Band-Aid, which I think is there's a lot of that out there. We Band-Aid it, we treat the symptoms, it feels better, a pain patch, this and that calms the pain down, but the pain may not be coming from where you put the patch.
Right, exactly. So if someone has the pain and it's a chronic pain, and you assess them in that, walk us through, what do you do next after you assess what's going on?
Well, again, if they come in and they walk in, I'll put them through a basic evaluation. I'll ask you simple questions. What happened? How long has this been going on? Where's your pain? Put you through some basic tests to see, what muscles are firing or what nerves may be impaired, things like that. If it's something that we feel is, easily treated based upon my knowledge and area of expertise, then we treat it and we go ahead and address that. If it's something that we feel needs assistance, maybe we need to send them to an orthopedic doctor or another physician or over to the chiropractor to look more extensively in certain areas. That's our responsibility to do that. You have to send and refer out. But again, you have teams of professionals and it's working cohesively together with them. Getting towards the treatment side is really, again, addressing the dysfunction that lies, addressing the root cause of the problem. Your daughter, as an example, she had an elbow injury. Because of this elbow injury, she'll end up most likely having shoulder issues and neck issues because, again, it's a link in the chain. So you have to address the shoulder.
And he's right, because that's exactly what she's having now. She's having shoulder and neck injuries, and she's struggling.
So it's having to address the whole big picture. People who have knee problems may end up having hip and low back problems. Same thing with a foot problem, we may end up having knee problems. So it's addressing the whole chain. We call it a kinematic chain, but it's like a chain link fence. You got one little link that's broken, the fence ain't going to hold together. So it's when a lot of the clinicians fail to address all those links that the problem continues to remain. I felt great for 2 months, but now it's back. Well, it's back because it was never truly addressed. And it's very common.